skeleton includes the pectoral girdle and the upper limbs, the pelvic girdle, and the lower limbs. Clavicles are S-shaped bones. Medially, it articulates at the manubrium of the sternum. Laterally, it articulates with the scapula. The scapula. Each scapula forms a triangle with 3 sides. Inferior angle, superior angle, lateral angle. At the lateral angle, there is a cup-shaped glenoid cavity. At the glenoid cavity, the scapula articulates with the humerus at the shoulder joint. The humerus. Proximally, the round head articulates with the scapula at its glenoid cavity. The anatomical neck marks the extent of the joint capsule. The narrower surgical neck corresponds to the metaphysis of the growing bone. On the posterior surface, there is the radial groove which marks the path of the radial nerve. Distally, the shaft expands to either side at the medial and lateral epicondyles. The ulnar nerve passes behind the medial epicondyle under the skin. The humerus articulates with the radius and the ulna. Ulna is medial to the radius. Proximally, it articulates with the humerus at the elbow joint. It also articulates with the head of the radius at the proximal radio-ulnar joint. Distally, the ulna head articulates with the distal end of the radius at the distal radio-ulnar joint. The radius. The radius is the lateral bone of the forearm. Proximally, the disc-shaped radial head articulates with the humerus. Medially, with the ulna at the proximal radio-ulnar joint. The distal portion of the radius is larger than the distal portion of the ulna and it articulates with the below-carpal bones of the wrist and medially with the ulna at the distal radio-ulnar joint. The carpus or wrist contains 8 carpal bones. These bones form 2 rows, 4 proximal carpal bones and 4 distal carpal bones. We also have the 5 metacarpal bones, which proximally articulates with the 4 distal carpal bones and distally articulates with the proximal phalanges. We have 14 finger bones or phalanges. The first finger, known as the thumb, has 2 phalanges, proximal and distal. Each of the other fingers has 3 phalanges, proximal, middle, and distal. The pelvis consists of the 2 ossa cocci, the sacrum and the coccyx. Ilium, ischium, pubis. The femur. The femur is the longest and heaviest bone in the body. Proximally, the rounded femoral head articulates with the pelvis at the acetabulum. It articulates with the tibia at the knee joint. Distally, the shaft ends by medial and lateral condyles. The patella. The patella is a large sesamoid bone that forms within the tendon of the quadriceps femoris that extends the knee. The tibia. The tibia is the large medial bone of the leg. Proximally, the medial and lateral tibial condyles articulate with the medial and lateral condyles of the femur at the knee joint. The anterior margin of the tibia can be easily felt under the skin. Distally, the medial border ends in the medial malleolus, a large medial projection. The inferior surface of the tibia articulates with the tarsal bones at the ankle. The fibula. The fibula is the slender lateral bone of the leg. The fibula does not help transfer weight to the ankle and foot. Even, it does not articulate with the femur. The fibula is important as a site for the attachment of muscles that move the foot and toes. Proximally, the head of the fibula articulates with the tibia. Distally, the tip of the fibula forms the lateral malleolus, providing lateral stability to the ankle. The tarsal bones. There are 7 tarsal bones. The large talus transmits body weight from tibia toward the toes. It articulates with tibia and lateral malleolus of fibula at the ankle joint. The calcaneus or heel bone is the largest of the tarsal bones. The posterior portion of the calcaneus is the attachment site for the strong calcaneal tendon, arising from strong calf muscles. When standing, these muscles can lift the heels off the ground to stand on the tiptoes. The distal surfaces of the tarsal bones articulate with the metatarsal bones of the foot. There are 5 metatarsal bones which articulate proximally with the tarsal bones, distally with the proximal phalanges. There are 14 toe bones or phalanges. The great toe, known as the hallux, has 2 phalanges, proximal and distal. Each of the other toes has 3 phalanges, proximal, middle, and distal. Cranial bones: frontal bone, occipital bone, 2 parietal bones, and 2 temporal bones. Ethmoid, sphenoid. There are 14 facial bones of the skull: 2 inferior nasal conchae, 2 lacrimal bones, 2 nasal bones, 2 palatine bones including the horizontal plate, the vomer, 2 zygomatic bones, and the maxillary bones. The maxillary bones are the largest facial bones. Maxillary bones articulate with the frontal bones and the ethmoid with one another and with all the other facial bones except the mandible. It includes the orbital rim, the anterior nasal spine, which is found at the anterior portion of the maxillary bone, at its articulation with the maxillary bone of the other side. It is an attachment point for the cartilaginous anterior portion of the nasal septum. We also have the alveolar process that borders the mouth and support the upper teeth. Finally, we have the palatine process, which form most of the hard palate or bony roof of the mouth. The mandible. The mandible forms the lower jaw. The body of the mandible is the horizontal portion of that bone. The alveolar process supports the lower teeth. Mental protuberance or chin is the attachment site for several facial muscles. A prominent The mylohyoid line marks the insertion of the mylohyoid muscle which supports the floor of the mouth. The ramus of the mandible is the ascending part that begins at the mandibular angle on either side on each ramus. The coronoid process, condylar process, which is the insertion point for the temporalis muscle which closes the jaw, the mandibular notch, which is the depression that separates the condylar and coronoid process. Mental foramen.